I am actually the Labyrinth project development worker here in Glasgow, which is the equivalent to the Navigator across UK. The reason why in Glasgow or Scotland is called differently is because we already have a Labyrinth, we already have like a Navigator project that exists here locally. So to avoid the confusion, we name this post or position differently from the rest, but we do the same work as the remaining of the Labyrinth Navigator workers. So yes, my background first of all is in business accounting, but my heart was mainly into like issues of social justices and working with marginalized groups, and mainly like with women. So after my graduation here in the UK in business accounting, I decided to do community development work, which was actually a huge change, going from numbers to like working with people, and I think I like it. So yeah, when I moved into UK in 2002, I became part of like an organization known as Karibu. Karibu was I would say maybe the first African organization in the UK, particularly in Glasgow, no UK, but in Glasgow, to come up with like solution or services that will help women who were moving from other countries to Scotland, and mainly in Glasgow again. So unfortunately in 2016, Karibu was dissolved. I think the reason why Karibu was dissolved is also part of what we are discussing here today, and which will be tied into like maybe capacity building, but also lack of resources and funding to some communities. So my last job within the women's sector was in a women's aid organization, and my position was a position of like a prevention worker, but also of a multi-agency development worker, which meant like liaising with like other agencies to come up with like a comprehensive like response to needs of women, but also voicing like our service users like opinion on the way that matters that are concerning them are being tackled, and mainly also how we can form the services, or how we can actually implement what they're looking for in terms of change that will actually meet the needs. All right, talking about the mapping, as with every other Navigator workers, I think most of us have done the mapping exercise. And in Scotland and here in Glasgow, we decided to go for a specific side of gender-based violence. We are all familiar with like different type of gender-based violence. Sometimes I will refer to it as GBV. So we chose to go for the harmful traditional practices. The reason is that in 2017, there was already a mapping of services that are available to women that was carried here. And we thought that like going back onto mapping the services again would be a repetition of what was done, but also we were aware that there were little that was done in terms of like a BME community, and particularly focusing on the harmful practices. What format did we use into the carrying of the mapping? So we have designed a questionnaire which was really, really elaborate, a very long one, and a questionnaire that was like shared to organizations that work with BME women, but also to organizations that work with women directly, to try and assess how their services is inclusive of issues of BME people, but also what would the capacity building needs be, and at the same time also trying to see if there are already organizations that are implementing good practices that can be shared with other organizations in order to become more inclusive of like BME issues. So we sent out the questionnaire, and we had actually a good response because we targeted a specific organization. As I said, a BME organization. Some people would refer to it as a BME, and also a women's organization. It was about, I think, 42 organizations altogether, and we had like above 50% response. from those organizations, which was a very good thing, providing that we were like really at the pandemic. And also like at that time, the government had tightened a little bit the rules about meeting face-to-face, which placed a demand onto women's organization in terms of like service delivery, but they tried their best and the response was good. And other than the survey, we also had a focus group consultation with about 42 women, and all of those were done through, I would say, remotely. So we didn't have any face-to-face, which I found to be a little bit unfortunate because we missed out in that connection and in that side of discussion where ideas knocks other ideas and then bringing up like new responses to what people had as questions, but the responses in general were really, really positive. And what we have found out during the consultation, for me personally as a worker, was quite when we were designing the mapping questionnaire and also the consultation, we kind of like knew a little bit what was going on within the community, the BME community. But I think what we had missed was like the extent to which there were little services available to BME community and BME organization as well. So let me go back on my slide because I've been speaking without checking my slide. And yes, so what we found out was like the current responses and services provision for traditional harmful practices and were designed to respond to the form of harmful practices that we are more familiar with. And that would be issues around FGM, female genital mutilation, or honor-based violence, or sometimes forced marriages. However, when it came to other forms of harmful practices, most people were not familiar with. And being also aware of the change in demography in the UK in general, but particularly in Glasgow and Scotland, we thought that there was a big gap because the current services were only responding to those 3 main categories or 4 main categories, leaving the remaining out, and which meant like anyone who fell within that category were either, they were either not receiving the support that they needed, or they weren't reporting what was happening to them. So from the survey, what we have discovered is that I think you can see from the graph that most people were familiar with the topics or the form of traditional harmful practices that are at the bottom. You can see about 80% of people knew more about female genital mutilation and honor-based violence and forced marriages. And when it came to dowry or bride price abuse, I think you can see from there that the percentages or number of people who were familiar with started to reduce significantly, to the point of when we're getting to the breast flattening abuse or harmful practices, they were like almost less than 10% of people or of organizations that we surveyed who were familiar with it. So in terms of the type of harmful practices that we can actually encounter in Scotland or in the UK, I thought maybe I should put in a highlight on polygyny. I think some people would refer to it as polygamy, but polygamy is actually the opposite of polygyny or gyny, in the sense that polygyny is actually when a man has multiple spouses, and we sometimes refer to it as mistresses, which is not really mistresses, because in this case it's like a second or a third or a fourth. Some men will also go into like marrying 10 women at once, like having them all together and sharing like beds with them like on different days. That is the main issues in here, because it's still actually being practiced in the UK. by saying that it's being practiced, I know that there are no numbers, or there are not maybe official research that were carried in terms of like identifying how many women are suffering this and how many have reported. But the truth is that many women who will go through this situation or type of abuse, they will not report it because traditionally it's acceptable. And it's sometimes also, it has been said to women, you can choose to leave the relationship or stay in it. But people might ask, yes, I mean, might say, yes, you can leave. It's difficult for a BME woman to leave a relationship where there is a dowry that has been paid. So in my slide, what I've said that like this form of harmful practices, they can fall into a different type of gender-based violence that we are familiar with. So polygyny, dowry abuse or bride price abuse, hymen reconstruction, barrenness abuse, and so on. They can either fall into the category of domestic abuse or commercial sexual exploitation, rape, and it's really, I mean, it goes back and forth, and one aspect can fall into multiple of them. So going back to polygyny, what I was saying is that the dowry is something that ties a woman to a relationship, because it doesn't tie only that woman, it also ties her entire family, and it ties her children, because most of African tradition that will pay dowry, that will confer the right of that woman's children to the husband, because that will be the system that a patriarchal system that they are operating into. So meaning that from a union of two people, when children are born, those children belongs more to the husband or to the father's family than to the woman. And one might ask the question of knowing, like, okay, when you are an intellectual woman, how can you even let that or accept that when you're living in the UK? But I've been speaking with so many intellectual women here who sometimes, I think maybe out of habit, will refer to their children as, or when they're speaking to their family-in-laws, they will say your children, they will not say my children. So sometimes, somehow, deep down in the brain of those women, it has been instilled that those children are not yours. So for a woman who is willing to leave because she doesn't want to share her husband with someone else or a partner, she will think about her children, she'll think about the dowry and the families and everything that comes with it. So you just have to bear in mind that aspect of like that, the side of thing that ties a woman to a relationship. So there is no need for me to go on dowry because we've touched on it a little bit there. But a dowry is also, that just like to speak briefly on it, it's another form of abuse, but this one is quite a controversial in the sense that some BME women, they will see the value in the dowry being paid. So a dowry which was meant to be a gift to appreciate the fact that your family, your wife or your wife's parents have brought up a beautiful woman, and a woman who's educated or who has capacity and capabilities became now an object of manipulation and control from both sides. So from the woman's side, because in some tribes or some culture, it is done on the opposite way. So meaning that it's actually the wife who pay, or the bride who will pay the dowry. But in the context of Africa, most countries, it will be the husband or the groom who will pay the dowry. So there has been like a kind of like, I would say, they have made this dowry issue, it became an issue of like wealth now, in the sense that people are now asking more and more money. Instead of it being a present, it has become now a business that people are entering into. And in that sense, if someone has paid a high price for a bride, they demand a lot more. And also in some men, it's not the culture that says that, but some men will see a woman as their property, they belong to them now. And that will not only be the man, but I mean, his family as well. And that part of the dowry is also ties into the barrenness abuse, because if the woman to whom they pay the high price is not bearing children, mostly people will not look into the causes of her barrenness, whether it's coming from her or from her partner or her husband. The blame will be placed on her. We have paid a high price for you. You have to do your best to pay to bear us the children. And these are no things that are alien to us in the sense that we are living in a Western country, and that doesn't happen. It happens in communities, because communities tend to bring the culture, which are not bad, but sometimes it hides the abuse that goes into it, into the communities. And I wanted to touch as an example of other forms of harmful traditional practices, the levirate. The levirate is basically when a widow, so a woman who was married to someone and then the partner passed away, and her late husband, because it's mainly like in terms of like marital situation, her late husband brother should marry her. And that is a demand and a requirement, regardless of whether she likes it or not. And just to name these few, you can see that there are a lot of people that are coming from countries where these harmful traditional practices are in operation, and not many people will know about it. I will give an example with some other organization where I worked previously. We had a case of, I would say, polygamy. A girl came in and she was disclosing the fact that she was in a relationship where she never, there was another woman with her husband, because she came here, she was young as a student, and then ended up having a relationship with a man with whom they had one child. And when she decided to move in with that man, there was another lady in the house, and that lady was the person responsible for her everyday need. She was the one handing her money for food, for anything basically. And every time that she asked her husband or her partner who that woman was, she never had a clear response as to who she was, but the partner was sleeping in the same room as the other woman, but without defining clearly who she was and what was her position within that relationship. And that can become a mental situation or mental torment to a woman who's trying to understand what is going on in here without having a clear response. So when she came to our organization, because we weren't, or some of my colleagues were not familiar with this type of practice, they doubted her story completely. All right. And I remember the term that was used, that her story is dodgy. And I know clearly that from a women's organization, we say we don't judge another woman because her experience is personal to her, but it wasn't done through malice or through discrimination. It was just a lack of knowledge. And these are the kind of lack of knowledge that we want to address to be able to support these women. Moving on to demography in Scotland, for example, between 2001 and 2011, the demography changed. We have had an increase of about 1% or more of Black African people moving into this city. And I'm expecting, just like from what I'm observing, that this census that we're having now, we will see also a huge increase in the population. However, when we're looking onto issues of gender-based violence in general, they have not been designed, or they have not been planned with this demographic of people in mind. And when we go deeper or low, I mean, we move away from the bigger picture of gender-based violence, moving on to a BME organization, even the service provision that are tackling harmful traditional practices are not addressing these issues. So basically, we have a huge number of people who are going through this and without any support. And I'm also aware as a person within the community that there are a number of African girls young girls who were, some of them arrived here at the early age, maybe 1 to 3, to the best, maybe 5, or some of them were born here who are getting married, and it's a condition that the dowry is being paid without really having a deeper conversation on what is going on in the context of like dowry abuse and other forms of harmful practices, will be leaving out a huge number of people who can be subject to abuse, gender-based violence. Maybe I should also be touching on to how to work with BIME women, or what people can retain from that. And first of all, I wanted people to remember that traditional harmful practices are not limited to FGM, honor-based violence, or forced marriages alone. So it's really down to us to do some more research. And I'm hoping that going forward, funders, researchers, and everyone else who is interested in informing organizations and other people on those issues will do more work to make it more visible, but also to give people or organizations the opportunity to create a place where people will feel safe to come when they are experiencing other forms of traditional harmful practices. And the second point will be that, as in the UK, we also need to become aware of our own harmful practices, and also of the modern harmful practices. I'll name few, such as like heavy drinking. It's a harmful practices that we have in the UK. And in terms of like modern harmful practices, we can talk about labiaplasty, which is becoming, we modernize it, we make it sound more fancy, but when you look at it from a lens of gender-based violence, that can also fall into a form of harmful practices when you look at it closely. So why should we become aware of those? Because that's actually makes us to, it causes us to not become judgmental of other culture, because the fact that we can be judgmental, it's closing the opportunity for us to collaborate with those communities who are experiencing other forms of gender-based violence. The third point will be like, we need to go extra mile by creating, as a practitioner or as a worker, going extra mile by creating a support plan that is adaptable to the needs of BIME people. And let's say a woman comes to you with a situation that you are not familiar with, do more research, and then make sure that in trying to create a support plan, that support plan is actually really capturing the needs of that woman. No, really, I mean, we should not be using a one format that's fit all of us. No, we have different issues, we have different barriers. Therefore, the service or the support that we're providing should be also adaptable to those differences that we have. Organization and support workers should become more culturally sensitive, and also being, I mean, the use of language that is appropriate. This is actually one of the reasons why most of BME people will not engage with other services, because they feel like they're being judged, and simply because the other part is not understanding the culture. So becoming culturally sensitive is one of the response to that. In terms of language, sometimes language can be, actually no sometimes, but most of the time language can be a huge barriers, and colloquial sometimes can become unfamiliar on both sides, because those from here have got their own colloquial, but also those coming from abroad have their own. And because most of like, I'll give an example of like African languages, they do not really translate in terms of like word by word into English. And that can also create a barrier in the supporting sessions. And to respond to that, what can be done would be maybe to employ someone who's familiar with those other forms of like language that African women will utilize. All right. I was also thinking of like a organization being able to employ people from the community that they feel like are not engaging. And why am I saying that? Because there is a huge experience and expertise within those communities that can actually be utilized within organization. Yes, and when we are employing BME, when we are employing BME people, it should not be under the umbrella or under, I mean, it should not be with organization trying to tick the boxes of equal opportunity. It should be more because we're valuing what you know and we're valuing your skills, and we want to utilize to utilize it within our organization to be able to best support the people from the community where you are coming from, or the community that you can relate to, because it's always not easy to employ people from the same community, but at least they can relate to, because even from the consultation, what women have said, they've said it makes it easy for them to engage with someone who's relatable to them, whether it's by culture or by language. All right. And all right, so in terms of like, I just want to summarize our findings. So the findings was that like, I think I went ahead by giving an advice of what people should be aware of. But in our findings, we found that in terms of services, most of the services were not adapted to BME needs. We've already said that in terms of like staffing or workers, most of BME within organization were actually occupying the roles of volunteers as opposed of being employed. And even when they were employed, it was either on temporary basis or reduced hours capacities. But some people have also disclosed that their pay was also different from the remaining of staff. So that is something that we have found out from the survey and also from the consultation. And the support plan wasn't adaptable or adapted to the needs of the people who were reaching out to those organizations, and which created like a more vulnerability for those people and a prolonged exposure to trauma and stress. And in terms of like fundings, most of BME organizations are not well funded, and those who are well funded, they also have seen like a cut in the funding that they have received. And that creates actually a situation of competition within the BME organization. Obviously, those who have been there longer will be the one maybe being funded continuously. So despite the fact that those existing BME organizations that are being funded, their service is not capturing every other forms of traditional harmful practices, but the new organization emerging are struggling to secure funding, and it's just like makes it like difficult for people coming from parts where they're experiencing other forms of harmful practices to receive the support that they are in need of. All right, and representation, in terms of representation, what came up was that BME women in general, so regardless of whether they are from South Asia or Africa or Middle East, they are not represented in Glasgow at a decision-making level or strategic level. No wonder why the services that are implemented do not really capture fully their needs, and they don't also respond to those needs at the same time. Okay, I've already mentioned the lack of expertise and experiences from BME. I will hammer on it again. And I always believe that if there is a capacity building need, or if there is because it has been said in the past that people from BME organization communities do not have the capacity to run organization. I believe in equity. When we acknowledge or we identify a gap in capacity, it's up to the founders, but also up to decision makers to invest more into that community to bring up the capacity in order to equip them to deal with the issues that the communities are facing. Bernice, you've asked me to just say something about the way forward. The way forward, it will be to have services that are culturally informed, regardless of whether they are BME or non-BME led organization. And services should be inclusive of non-represented BME communities. When I'm saying non-represented, is because in Scotland, for example, we have seen that South Asian, because they've been here longer, they have quite they are quite advanced in terms of having services that are responding to their needs. However, when it comes for African organization, African communities, or other communities such as Middle East or non-South Asian communities, there is actually a lack of those services. So organizations should become either inclusive of those services, or create a project that will tackle the needs of other of non-represented BME communities. The creation of projects that will respond or tackle those issues at the same times, and investing in capacity building, which was already said, for the underrepresented community, and a regular review of services that says that they are providing services support to BME organization. Because what we've noticed that funding are being allocated to organization, and it says that it's for BME people or BME communities, but when you go down to the communities, most of them are not really benefiting from it. So we need to become more accountable, but also from the funder point of view, they need to review on a regular basis to see whether the service that is being provided is actually meeting the real need of the people in the communities. We need to also ensure that BME people are represented at strategic level and decision-making level, so that they bring up the voices of the community. And we also have to see those voices being translated in services implemented in the communities. And one thing that we need to remember, BME is not equivalent of South Asian. It's no equivalent of South Asian community alone. I'm so grateful and thankful to our sisters from South Asian communities for the beautiful work they've done and the lead that they are taking in terms of harmful practices. But we need to see more BME communities being represented, so that funders will not only resolve into funding one type of BME, but also funding other BME organization and empowering us together. So that will be me for today. Thank you.
Thank you so much, Mimie. That was so interesting. Thank you for that. I know we just have a few minutes, and I think there was a question in the chat that we missed on. So if anyone else has any questions, please hold on to them just for 1 second, because I believe Zainab asked earlier if you could give a quick review of what is witchcraft practices. And I know this is a huge topic, but if you wouldn't mind maybe just giving a little bit of information or signposting so that we can all keep learning about this as well.
All right. Witchcraft practices in here in UK, it's being referred to a practice that aims at abusing young people mainly, although the witchcraft practice is not limited to young people alone. because from documentary or resources that are available here in the UK, it's referring more on abuse of children, but also with child protection aspects of policies to see how to protect those children. And just to speak about it briefly, witchcraft is the practice where by a child's behavior or a child developments has caused issues to parents, instead of them seeing it from a psychological point of view, it's more being seen from a spiritual point of view. And I mean, I know some people have said it's churches that are practicing it. It's not only churches. African countries have these historical, I would say, experience with spirituality. And those who have lived or who have a small knowledge in African culture, you see there is a huge element of spirituality. And in some cases, those spiritualists will abuse their position, and by actually equating someone's behavior or mental health to witchcraft alone. And the process of trying to remove that witchcraft from a person can be very abusive to human being. So I will speak of it in general, instead of like focusing only on children. Women can experience it. A woman who is having, for example, a postnatal traumatic stress, they can equate it to witchcraft as well. So I think for me personally, it's actually a spiritual side of things that has gone bad. That's how I'll describe it.